This trigger film was developed for health services to use as part of an experience-based co-design process, EBCD. EBCD is a patient-centred quality improvement process. The film is intended to get local people, patients, families and NHS staff talking together about how they can jointly improve people's experience of health services. You can find out more about this process and how to use trigger films by accessing this link to the EBCD toolkit. This film draws from a collection of 30 interviews about ethnic minorities' experience of mental health. The interviews were conducted across the UK by Health Experiences Research Group at the University of Oxford. It includes people talking about their experiences of being diagnosed with a mental health problem, about getting help and accessing services, about treatment including medication, being in hospital and services in the community, and about interactions with health professionals. The full study can be seen on healthtalk.org. We'd like to know more about how you used this or other trigger films in the collection, and would be grateful if you would spend a few minutes completing the feedback form. The link is here on this page.
Well, the more recent stuff is just feeling utterly crushed and feeling completely despondent, friendless, helpless and completely vulnerable in a very hostile environment. I mean, it feels that if I open the door, poisonous gases are going to rush in and kill me. It feels, when I get days that are not good, it feels like there's been a nuclear war and everywhere is poisonous and radioactive, and I get all kinds of horrible images coming up in my head, usually images of death or somebody's I know has died, something really unpleasant.
Sometimes the doctors don't take a lot of notice and they just put everything down to anxiety, panic attacks and this and that. It's like if you get aches and pains, oh, it's anxiety. If you get a swollen stomach, oh, it's anxiety. You're worrying too much.
Even from your GP, you don't get the time to explain things. It just gives you a few minutes, whatever, and then, you know, I mean, the one I used to have when I was younger, used to be there nearly every week to him, but because I couldn't describe the psychological fears, I was always describing things like the stomach aches or headaches or, you know, not appetite and stuff, because I didn't even know, you know, what anxiety was. I didn't even know what the words were for that, and because I didn't have the speaking skills as I do now, I wouldn't be able to just, you know, might say a few words to him, but I wouldn't know how to describe it at all. You know, even if I did describe something to him, or if I thought I could describe it, I'd be worried that he might misinterpret it or misunderstand it and give me sort of medication, you know, wrong medication or whatever, or you know, send me to a mental hospital or whatever. You know, I mean, you know, going to a doctor at 15, my ability to describe things is really bad, and he wouldn't, you know, spend enough time with me to ask me the right questions in a way. Before I'd, you know, describe things, he'd be writing the prescription already.
I never believed in psychiatric. That's the thing. I think this is probably the culture that I'm brought up in. That is basically, first of all, mental health is a taboo issue. Secondly, it's It's always, when you hear about patients who are mentally ill, they always seem to go to doctors like 10 years, 5 years, or they've been a mental patient for life. They have chronic depression for the past 20 years, so they never tend to get fixed like other diseases. If you have a problem with your appendix, you go to the surgeon, he takes it out. But if you have a mental problem, it's like you take the medicine for the next 20 years, and that's absurd. So I think that sort of made me stay away from psychiatrists.
In my case, I suppose, there was no, I suppose maybe I was lucky or fortunate that, I was taken, in terms of, I was, I suppose, forced really to go and see a psychiatrist. I mean, I wouldn't have gone on my own accord really, so of course there was a process of coercion and, force, but I think hindsight, it was probably good for me, because it would have, had that not happened, I would probably have deteriorated to a stage where I was at risk myself, because some of my actions were quite dangerous. I was doing some absolutely crazy stuff, and now I probably understand why sometimes people who go through a psychosis, at that stage they may disagree to say, well, we're forcibly taken into a hospital or section, but sometimes we are human beings, and sometimes. But it's the manner that happens. Yes, it could be construed as very, very oppressive or very. But I think it's it's how it's contextualized.
Yeah, well, I think one of the good ways of providing a very good tailored service would be for mental health expert professionals to work with the families, to work with parents, to work with brothers and sisters in the family, to sit down and talk to them. So, for example, I'm a patient. It would be great if my parents and my family were able to sit down with my doctor and my psychiatrist and the mental health nurse, as well as the crisis team, and sort of talk together about the best way forward, so that everyone kind of feels involved, everyone feels they can contribute. And then also the family, who have sort of no experience of mental health services, have a better kind of understanding of the system. They know that an emergency where they can take the son or daughter to, rather than knowing nothing, and then when an emergency arises, to just sit there and say, oh my God, what do we do now? I mean, I think that's a good way. That's a sort of a good start, sort of technique that could be used. I think it's not used, and it could be used more frequently, certainly. I think maybe more leaflets, more information in layman's language could be distributed to the families. For example, when the crisis teams come to your home, maybe they can leave a few leaflets to family members. You can have a look through them.
And you mentioned that you tried, before this medication you have now, 22 others.
Yeah.
What was it that wasn't right? How come you got through so many, do you think?
Or either they didn't work at all, or they were extremely sedating. I think, I can't remember which medication it was, but I would sleep like 20 hours a day. Well, the doctor said to me, well, at least your symptoms are gone. Yes, but I'm not alive really. I'm just sleeping 20 hours a day. At least your symptoms are gone. I said, you don't get it that every person should have a life,
And this one that you're taking now?
Yeah.
Do you know the name?
It's quetiapine. It's an atypical antipsychotic. It also has the name Seroquel. I mean, that has been the most helpful. I'm also on on an antidepressant called citalopram. I take other medication, but that's for physical ailments. So, that has been the kind of right balance, and that's kind of helped me, I would say, this last year or so.
And you've got the dose right?
Well, I've been kind of told by my doctor, if I feel like I need a bit more, I can give myself a bit more. Not many doctors will say that to their patients. So I've helped when I feel like I've gone slightly a bit more paranoid, I will increase it myself.
Prior to seeing my new psychiatrist, the services was quite appalling, really. I didn't get much help. I didn't seem to have my problems taken seriously. Nobody seemed to have a clear idea of what they were doing about my illnesses. And I seemed to go from one different specialist to another. I've tried all the soft stuff, like different therapies, meditation, exercise, all of that, and it just doesn't work. Whereas since I've been on my medication, I really have felt like a different person, and it's been a real lifesaver for me. I've reported back to my psychiatrist and told them how I'm feeling and how I'm behaving. They've come up with this regime of tablets and medication that seems to work okay. It's been a very good approach because it's been gradual. Give him a little bit of medication and see how that works. If he's stable, that's fine. If not, just keep on increasing the dosage and maybe reduce the dosage of something else. For me, a proper treatment, a proper recovery is where your illness is taken into account and treated seriously.
And so did you experience difficulties expressing yourself, for example in therapy or?
Oh yes. The fact that I was not confident about my English, put me off. Within this counselling course, it's when I became about how important it was for me to speak up. The first day, it was about 50 people sitting in a room. I remember saying at the very last minute, I want to say something. Shaking, and I said, I'm shaking. I explained, I'm a foreigner. This is the first time I'm in a room with so many English people, English speakers that speak so fluently and so easily, but my heart is coming out. So expressing exactly what I was feeling, that was all I needed. So that was another big lesson.
Stop seeing diagnosis, see people. It's the bottom line. If you base your interaction with another human being on what somebody has said they are, you're going to fail. You're going to fail that person because you need that person to show you who they are. Then, if you want to read what somebody said about that person when that person spent 10 minutes in front of them 6 months ago has got to say, then read on. But don't allow it to cloud your ability to see another human being. Okay, some people can be quite severely disabled by their condition and they can have quite extreme illness or manifestation of their illness. And I accept that. But still, you need to see a person.
The best thing that happened with the mental health service now is the communication we get from the psychiatrists to say that we are allowed to see what they wrote, the writing about us. So that is a good improvement. Before they kept everything a secret. We had to have special permission to see what was written. But now you can just sign a piece of paper and say, yes, you want to see what the psychiatrist wrote to the doctor or what he puts in your file.
Well, I don't want a psychiatrist anyway, and I don't want a CPN either, because I just feel that sometimes they do things behind your back. They'll write things down about you, and you don't know about it, and you're merrily going along thinking, well, everything's okay. And it's not, you know, from their reports. And that can do a lot of damage when you do find out, and you think, well, who can I trust?
My psychiatrist is white. My nurse, she's a black woman. It's the mental health team is reflective of the kind of ethnicity of the area I'm in, which is really good actually. So there's a mix of white, black, and Asian professionals. You know.
Do you think it matters?
It does matter hugely. It matters. You know.
In what way?
It's just you just feel more at home really. It's a very huge, tricky subject actually. But it's just to me it just feels nice that there is a mix of not only ethnic backgrounds but ages and kind of sexualities and it all, you know, all that really, you know, is helpful. You know. Because I mean, how could I relate my life to, for example, a white middle-class professional male, when my experience has been the total opposite. You know, that he's in a very empowered position, not really understanding what it is to be disempowered.
To be honest, you know, my psychiatrist, he's white. My mental health, she's white. Every single professional I've worked with, the majority of them are white, and every single one of them has helped me. Every single one of them has wanted me to recover.
I remember going there and thinking to myself that I might never be able to call myself normal again. And they was going, oh, we'll take you up to your room, and took me suitcase. And this woman opened my suitcase and she was checking everything. Checking, you know, the toiletry bag, the side compartment, shaking out the clothes. And I'm looking at it and I'm thinking to myself, why on earth are you doing that? You're making me feel like I'm a prisoner. I said to her, what do you think I'm going to have in my suitcase? Oh, we've got to make sure you haven't got any drugs or alcohol or things that you can harm yourself with, or any pills that you shouldn't have, and blah, blah, blah. And I just sat there and cried because I couldn't believe that I was there. And I didn't remember why I decided it was a good idea just to come there. And I just never spoke. I just never spoke. For days I never spoke.
Well, my times in hospital have been very kind of, like I said, traumatic, you know. I remember one of the first times I was on a mixed ward, and there were kind of guys that would just pester you, you know. They wanted, you know, you to go out with them, or they even asked, you know, really kind of abusive stuff like, you know, can you give me a blowjob and stuff like that. And the nurses did nothing to kind of stop it. Even if you told them this was happening, they say, you know, they would just shrug their shoulders.
You mentioned the system being racist. Have you seen examples of that?
I've seen plenty of examples of that. I mean, when I've been in the hospital and say somebody's been acting up, I've noticed that if a white person acts up, the nurses will just talk to them. But if it's a black person, they would have physical force used on them.
How about you? Have you experienced racism, do you think, at the hands of the system?
Kind of not in a vicious way. People are making assumptions that because I'm partly Asian, that they'll just automatically assume I eat curry and speak Urdu or Hindi, and I can only speak English. I can do some sign language, but I can only speak. They kind of assume that, you know, they're helping by, but they should, you know, you should ask first. You know, don't speak to me in Urdu and assume that I understand. You know.
And what rights? Do you know what rights you have?
No.
No. Did you know at the time?
No. They don't tell you. They give you a piece of paper and you're supposed to read them, but people when they know well don't read them. So it's better if they read them to you.
Are there any other rights that you think people should know about, like specific things?
About what visitors, if you can have visitors or your children can come in and visit you, and is there room for them to visit you, safe from the ward and all that.
हमारा तो जो प्राइवेट हॉस्पिटल फर्स्ट सप्ताह के ट्रांसफर होर्सल साइक्लामेन हॉस्पिटल इनो आइया ये सिचुएशन देख क्या हमें रोइसी ना हमें हमारे पूरे फोन करे होइसे घुमाई तू सखालात অত গন্ধ আর অত বাদ জায়গা এসে গরম মরা পেস্ট এটার উপরে কমপ্লেন আমি দিয়ে আসছি অন্তত তোমরা কার্পেট বদলাও বুঝছনি এখানে খাইরা গেরা যখন 1 ঘন্টার ভিতরে আমি আর দিছিলাম আর 3 মাসের লাগে ওনা হারাইতো আছে নার্সে গে হলে তুই যদি ফসন খরচ না তুই এখন পারো আর আমার পুরিরা কইলে তুই তোর মারে যদি লাভ খরচতে এখন বার কর না 3 মাসের আগে বার করতে পারতে না তাই লগেও গিয়া হইছে বড় ডাক্তারের লগে দেখা করতাম চাই বলে না ডাক্তারের লগে খাইল বলে না খাইল না এখন আমার দরকার এই সিচুয়েশনের মাঝে মানুষ হইলে মানুষের বেমার ক্ষমা ছাড়া বলবো
When you're with a group of people, you can sort of talk, and while you're there for 1 or 2 hours, your mind's off. At least you know you people understand you, and then when you oh yeah, and then what happens in the support groups is that you go around telling your little story about 3 or 5 minutes, you know, depending on the number of people. 3 minutes a lot, 5 minutes if they're not many, you know. So then when you go through, then somebody will say, oh well, I had the same thing, but I did this helped. Then you know it's coming from somebody who had the problem.
Let's start with the women's service. It was a very nice house, very well laid out and furnished, etc. There was nothing in there that I could identify with as a black person that made me feel welcome. It didn't make me feel like it was a familiar place, a necessarily welcoming place for me as a black person. The staff were, I won't say they're indifferent, they just did what they did, but none of it emulated anything that I was familiar with. The food we ate was English food, unless we cooked, and then it would be something different. And also, just generally, there is nothing, no one to support you. They just there was just lip service to the word support. There was no real support. There was no real tangible thing that you could take away that helps you to get on with your life or rebuild your life. And it wasn't culturally sensitive to say that, you know, from a cultural point of view, you may experience this. This is a good coping mechanism for this and this and this. And there was none of that. There's none of that. When someone comes in and they see something or feel something that is familiar to them, it helps them to feel comfortable and relaxed. And then your interaction with that person is better. They come away with something more. And this is what services don't do. They don't. It can be as simple as a smell. I've had people come in here and when they're doing the training and the caterer comes, and the caterer comes in and he brings rice and peas, and a man walked in, he said, "Boy, smell like home." Do you know what I mean? Something as simple as that.
You said about services specifically for women from black and minority ethnic backgrounds. What kind of things would you want from the
like
service?
support groups, so you could support yourself, support each other. So there'd be a service there that people, women can come and join who've got the same difficulties and they've got children, and they can bring the children and not worry about that what they say is going to get them the children taken off at the end of the day. That it's about helping support each other and being able to talk together and getting ideas off each other.
And you think specifically for ethnic minorities though?
Yeah, because it's important, because there's different cultures and you're not allowed to talk about it in the community because it's an embarrassment. So it'd be nice if it was just for us in the ethnic minority community.
I think the experience of being part of the day service care was discriminatory against women, against black people. There was nothing. I went to the day centre and I just thought, why am I here? There's nothing that interests me. There's nobody here who I can identify with. There's no activities that I'm vaguely interested in. There's nothing. So why am I here? But, you know, I kept getting calls and you've got to come and you've got to come and you've got to come. And so I just kept going because I was told to go. And, you know, I was in that mindset where I'll just do what people told me to do because I thought, well, perhaps they know better.
Policy shouldn't be kind of dictated by the kind of doctors and managers and policymakers. You know, service users should have input as well. In some hospitals they do, but you know, it's still not enough. So I think where fundamental change can happen, it needs the service user kind of input. Otherwise, what's the point? You're not listening to the people who use the services. So.